Welcome to one and all on this important topic of health informatics, the intersection of healthcare and information technology. As introduced, my name is Danny Poo. I'm an associate professor at the School of Computing at the National University of Singapore. I would like to bring you to the history of information technology to start off our discussion on health informatics itself. The first generation of computers actually began as far back as the 1940s. Some of you probably would have seen this kind of computer. It is a computer made up of vacuum tubes. And the very first computer that was created, called the ENIAC computer, uses this vacuum tube, 17,000 of them, to build a computer itself. And as you know, such vacuum tubes are very hot, and it can't really last very long if you were to use it. And obviously, if you use it in today's context, this computer may not be usable in that manner. The second generation of computers began way back in the 1956 when transistors was invented. You can think about transistors as amalgamations of a number of capacitors, resistors, and the like put together. So transistors make the computers less hot in that case, because vacuum tube basically are done away with. And in this picture, you can see the computer itself is very large. All right? So you can say that this is one computer used by one person, a very large machine for what is being developed as a computer. This is the IBM 1620 transistor computer that you see. And came along with computers are programming languages. We have assembly languages, we have COBOL, we have Fortran, the common languages at that time. Fortran is a language that was fairly used by engineers. And in fact, I remember during our early days, our engineers in the universities, they were trained intensively in Fortran. COBOL was another language that was developed and it was used in the business sector itself. That was the second generation computers in the 50s and the 60s. Then came the third generation of computers when integrated circuit, sometimes I call it the IC chip. The integrated circuit chips came along that really transformed the nature of computer. Computer became very small. That's what you can see here. Well, you can say that it's not quite small, but it was small as compared to what they had earlier in the second generation, certainly. So that was the third generation computers that came along. That was the first Apple computer that came into the market itself. The fourth generation lasted a much longer time, for about 30 years or so. In 1971, when microprocessor came along, and in a way, it has transformed computers into what we call the personal computer. The personal computer is one that is owned by an individual. Early days computers were very much owned by enterprise for the work of the enterprise itself. But when the fourth generation computer came along with the concept of personal computer, everyone owns a computer. Of course, you can say that, hey, this kind of computers, even though you own it, you can't quite bring along. Yeah, indeed, you can't bring along. You have what we call a desktop. You put it on your desk itself. So the personal computer that we had at that time, in the 4th generation, we left it at home or in the office, and we use it there and then, but not on the move. So that was the personal computer that we had using microprocessor silicon chips. Languages that came along during that time was Java and Python. Some of you probably have heard of Python nowadays. Wow, you may ask me, Python at that time? How come I was there during that period, but I never heard of Python? Yeah, Python wasn't really popular at that time. In fact, Python was actually invented in the year 1991. And only recently, as in, say, past 10 years or so, Python had become much more prominent and popular among new programmers. Of course, Google came about in the year, Google was founded sometime in the year 1998 or so. Facebook also came along at that time. So this is the period where we see Google take a prominence and Facebook become the social media software for most people to use. So that was the 4th generation. The 5th generation made use of ultra-large silicon chip itself. And with that kind of chip, you basically can shrink the power of computer into a very small machine. Sometimes we say that the machine that was developed using the ULSI chip was far more powerful than the supercomputer in the early 60s. Indeed, you are carrying a supercomputer everywhere you go with the 5th generation laptop that you have in your hand. Software applications such as artificial intelligence become prominent. M technology or mobile technology become prevalent. And in fact, everyone with a mobile phone, you are exercising M technology. And in this generation also, we hear of terms like quantum computing. Quantum computing is far more powerful and exercising power in hardware itself. This is the Chinese optical quantum computer called 九章 2.0. And it was created in the year 2022, just last year. And this machine can solve a problem 10 to the power of 24 times faster than a classical computer. You can think about a classical computer as one that you're holding in your hand right now. 10 to the power of 2 is 100 times. This is 10 to the power of 24. So you can see how fast this computer can run. And this is what we're talking about, quantum computing in the next leap of power, of computing power. So very soon, you'll be holding or using quantum computer in no time. So we are seeing the advancement in computers. And certainly, this is from the perspective of the hardware. Now we are in the 5th generation, and quantum computing will become a reality very soon. Everyone possibly have heard of this, the internet, where everyone is connected to computing power itself. The concept of World Wide Web came along in the early 60s, actually. The American Army used networks to communicate with one another. And subsequently, they released this technology to the world. And as we say, in the late 1990s, internet came along, and number of organizations jumped onto this bandwagon to create solutions on the web. The World Wide Web make it possible for even those who do not know computers to use computers. And it has enabled everyone to be connected and be able to use computers effectively through this idea of internet. Let's examine the history from the manner by which computers have transformed the world that we know today. With the use of computers or information technology for that matter, we have what we call digitization. Digitization simply means the transformation from analog to digital. Because computer is a digital machine, anything that a computer can read has to be digital. So we see papers like this being transformed into PDF format. A PDF formatted file is a file that can be stored in a computer itself. And you can view the contents of the PDF file. Viewing is not sufficient for us to let computers process what is available. We therefore need many other devices such that these devices become more intelligent, more discrete, more capable in doing the tasks that human beings have been doing. We see the advent of Internet of Things. Internet of Things is the use of connectivity and software to digitize physical things. With the Internet of Things, we have digitalization. In digitalization, you are basically adopting the Internet of Things and other technologies to transform operations, products, and your services. In this manner, you are able to take full advantage of the computers or digital devices to help you do the tasks that you have been working on. Thus, from paper, you are now transforming it into PDF, and from PDF, you transform that PDF into a digitally formatted contents that computers can use, understand, and work on them. With that, there is a process that came along called the Industry 4.0. Industry 4.0 is a digitalization of the manufacturing process. The focus is on operation. The idea is that operations that is oftentimes done by human beings can be now done by computers or information technology in this case. So Industry 4.0 came about because of the availability of digitization. The digitization is transformed into digitalization, where work are now streamlined, and you're able to do better data analysis. And now you have the operation also been automated. You have Industry 4.0. With that, it came about the need for digital transformation. Organizations are transforming themselves today through digital transformation. In what you see in this picture over here, we see digital transformation in healthcare. We talk about patient-focused system whereby the system focuses on the patient as the fundamental element of care using computer systems. We talk about disease prediction, whereby we are able to predict the oncoming of diseases. You probably have realized that in the last 3 years, when COVID came along, the scientists took, well, slightly less than 10 months to come up with a vaccine. They know so much about the disease when it first came along in the late 2019. And very quickly, everybody knows what the disease is about, and scientists went ahead to come out with the vaccine very quickly. Considering that we took less than a year to finally get everybody vaccinated. And in less than a year, yet another year, the whole world has now been, well, not totally, but majority have now been vaccinated. And on top of that, vaccinated a number of times. So you see that we are able to make use of this information through digital transformation, that data are now digitized and made available speedily through the use of information technology that allows organizations to hasten their processes and automatically done so. So as part, So as part of this digitalization wave in the healthcare sector, healthcare is now heavily supported by technologies. We see digital health and medical technologies, such as you see a watch that is able to measure your heart rate, is able to measure your oxygen level, and as well as being able to measure your brain wave as well. All right. So we see a lot of technologies that came along that is able to do things that we probably just dream of doing. And with that, a number of digital health technologies also came along through the use of wearable devices, through telehealth, through electronic health records, through electronic medical records, telemedicine, personalized medicine, and mobile health apps as well. Today, if you have COVID-19, if you have been infected with that, you don't have to go out of your home. And yet you are able to see a doctor to diagnose your symptoms through telemedicine. All these are now possible. And I also know that our polyclinic today provides Zoom services whereby you use technologies to allow the doctor to see the patient remotely. So these things are possible through digital health technologies. We look at these digital trends. Digital trend in healthcare has now happened. Big data and artificial intelligence. The idea of big data simply tells you that there is a lot of data, because now the data is digitized. There are a lot of data that are now usable, not so much by human being though, but by computer system. And that is a very important aspect of usage. If computers can use it, computers can do the work for you. So big data allows for such to happen. And put some intelligence into big data, we have artificial intelligence. The intelligence that is incorporated into machine, the computer system, that is able to deliver knowledge on behalf of human beings. That is artificial intelligence. We also allow for digital monitoring. No longer we need a nurse to keep going to the patient to find out the person's temperature, the person's blood pressure level, the person's heart rate, etc. That can be done remotely and autonomously. Computers can take over all this digital monitoring. Likewise, you can also do learning using computer systems. And in fact, this is very much the case nowadays, brought forward by the pandemic. E-learning is possible with computer systems and very much practiced today. Digital customer interaction. Your patient interact with the doctors through computer system. You no longer have a static, passive way of interacting with the doctors. They can communicate with one another interactively and real time. We have electronic patient record. The record is no more in PDF format or paper format. They are now stored in a computer system, and the patient data that can then be shared across institutions. For example, in Singapore, we have the National Electronic Health Record that is available to any doctors. Well, any authorized doctors who can see the patient record for diagnosis purpose and for treating the patient for that matter. That is now possible. An electronic patient record has been available in digital form through the use of technology. This is a picture taken from our Ministry of Health, where they envision the ward of the future through the use of technology. Radio frequency identification tracker. In fact, this has already been implemented in many hospitals. Vendor managed inventory that enables suppliers to monitor and top up the level of consumable and medication within the ward. This obviously reduces manpower required for such tasks. Again, this has also been implemented in some of our hospitals here. Inpatient recovery robotics that is able to help therapists in conducting rehabilitation exercises with the patient, recovering from stroke and other disorders. Robotic assisted beds. Again, such beds are now commonly seen in our hospital. The ward of hospitals has now been brought forward through the advent of technology. Ceiling hoists, autonomous transporters, you probably have seen some of them loitering around in our hospitals, particularly government hospitals. Clean fix robot as well. So all these brought forward by the use of technologies has now become a reality. Let's examine some of these applications. This is a set of pictures of pharmacy. Pharmacies that has made use of technologies in assisting them to prescribe and deliver prescription to patients, making use of barcode scanners, even robotic arms that is able to prepare medication for dispensation at the counters. At the back end of it, you have the robotic arm to collect the medication so that it can be delivered to the front desk where the patient can receive the medication. This whole process itself is making use of technology. This, you can say, is automated pharmacies dispensing. Likewise, we also see that vital signs such as blood pressure, heart rate, even temperatures, can also be done automatically or at one go. And these machines capture all these details on behalf of the nurse themselves. Likewise, also, you can make payment automatically. You don't have to go to a counter to make payment to a counter clerk. This can be done through machines, and the machine captures the payment done at the kiosk itself. Therapies also have made use of technologies in assisted therapy for the patient. Likewise, with the data, we have done data analytics, presenting insights from the data that we have. Mind you, the data are no longer static manual data. They are all discrete digital data that computer can understand and present in the form of chart, in this case. Finally, you probably have seen this picture, and it is a congratulatory picture of the launch of the next generation EMR in one of the hospitals in Singapore. I believe the staff are pretty proud that they are now able to use the next generation electronic medical record system in their work itself. All these itself are supported at the back end by a business information system. It is through this business information system that all these peripheral devices can function. We call this business information system the heart of information technology in healthcare. Healthcare professionals need to be trained to be equipped with such knowledge on the development, analysis, and evaluation of information system, so that they can support, enhance, and manage better and safer patient care. After all, they are surrounded by information technology in their work. This brings to mind this term called health informatics. What really is health informatics? You can say that health informatics encompasses the use of computer and information sciences for the purpose of benefiting and advancing healthcare industry, public health, as well as individual patient care. Health informatics is at the intersection of healthcare and information technology. I believe most of you are from the healthcare sector. So you have the healthcare knowledge. You are trained in healthcare. But now we add in this component of information technology, because your work now involves the use of information technology. If you are being trained to be able to understand both healthcare and information technology and how these two can work together for the betterment of healthcare delivery, you are practicing health informatics. For it is at the intersection of healthcare and information technology. What are the kind of job roles there are in health informatics? One of them is known as medical informatics specialist. You can just simply Google. You see a number of jobs nowadays that look for medical informatics specialists. And a medical informatics specialist has to be trained in health informatics. Or clinical informatics analyst, or executive, or manager. These are synonymous terms to the practice of health informatics in the industry. Pharmacists make use of computers as well. And you may have and such kind of job role called pharmacist, bracket, informatics officers. Obviously, he is trained as a pharmacist, but he is also now trained in the use of information technology in the pharmacy area. And therefore, he's known as a pharmacist informatics officer. Another very common terms that you probably have seen is called a healthcare informatics officer. So all these job roles are common in today's context, and they are increasingly being sought after because of the use of information technology in the healthcare sector. Let me walk through the kind of skill set, the kind of knowledge or concepts that you must be trained in order that you become one that can be considered as a health informatician. From the digitization perspective, one will have to be trained in the idea of digital data. Look at data from a digital perspective. Data that are created in computer system for computer system. They are no longer data that you scribble on paper. That is manual data, non-discrete and unusable by computer system. You need to be trained in the idea of hospital information system. If you work in a hospital today, you are likely to be using one of the hospital information systems. What are they? Why are they created in such a manner? How does it support your work in the hospital? That is the design of hospital information system that you need to be aware of in order to be called a health informatician. With hospital information system, you have varied manner by which they need to be communicated or connected. Therefore, there's a need for standardization as well as interoperability. When you think about interoperability, we are not just simply saying that human is able to interoperate with a computer, which most of us do, because we are able to use some software in the computer itself to carry out some tasks. That is man-machine interoperability. But today, with information technology, we want to go one step further. We are not just talking about man-machine interoperability. We are talking about machine-to-machine interoperability, such that two machines is able to communicate with one another without the intervention by human beings. And if we can do that, we say that the computers are now able to take over the work that we do manually. Incorporated within interoperability are standards. We need to create standards. And there are many standards that have been created over the years. And what are they? You need to know them so that you are able to appreciate why computers are developed in that manner and how computers can be used to lighten the work that you are doing manually. With the data of the patients incorporated in computer system, you need to be mindful of patient data security and to keep them private. So the topic on patient data security and privacy is important. And it's necessary for patients to be confident that their data in the computer system is safe and that it will not be released or leaked to people who are not supposed to have them. And from a digitalization perspective, we see that there are a number of technologies that are available, such as wireless technologies, mobile internet, cloud technologies. All these technologies are now easily available. How and what are the impact of these technology in healthcare delivery. We also talk about health information standards. What are the kind of standards that we need in order that computers are able to communicate with one another? And not just computers, but about human to human, man to man, doctors to doctors, nurses to nurses. Is there any language or standard way by which we talk to one another? For example, doctors in Singapore may not talk the same language as doctors in other countries like India, Philippines, England, Australia. The terminologies we use here may not be the same as those that are used in other countries. So there's a need for information standards to be established as well. Networks. Computers are connected via networks so that they are able to interact with one another. What are they? What's the issue with network? Networks means others can also connect it into your system. Undesirable elements may also come in. So how do you protect the network and so on? So all these need to be discussed and need to be understood as well. With network, however, you can have telehealth. And we have seen a number of applications of telehealth today, right? Whereby doctors are now able to make diagnosis of a patient remotely without being side by side with the patient. That is telehealth. In digital transformation, we see the rise of electronic medical record system, as well as the electronic health record system. Electronic medical record systems are used in hospitals. In Singapore, we have the next gen EMR system being deployed today. That's an example of an electronic medical record system. But in addition to this, there are hospitals that are interconnected with one another such that they are able to make use and see a patient record across the hospitals. Such data are now captured within the electronic health record system. In Singapore, we have the National Electronic Health Record System, whereby every Singaporean's data, health record data that is, are now captured in the National Electronic Health Record System and made available to any government hospital. So if you have been seeing doctors in Changi, and one day you have to visit Singapore General Hospitals, your data are now available across from Changi General Hospital to the Singapore General Hospital clinic itself. All these are made possible through the National Electronic Health Record System, whereby you have inter-hospital data communication that enables this. So you need to understand this itself so that you are able to see what system can be used for a particular purpose. To do that, you have to communicate with IT professionals who will be developing the system for you. And you will be involved in project management. The digital project management knowledge will help you appreciate your role as a healthcare worker in the overall circle of systems. With data, you can make use of healthcare analytics to understand data and generate insight from the data. This is now increasingly being used in any organization today, where analytics is a key role, key operation in an organization. With the data, you are able to know situations, and they are facts that allow you to make good decisions. And good decision making comes about and lead to better outcomes in the end. And to be able to present this insight, you also need to understand and learn what is data storytelling. All these dimensions are covered in this professional certificate that is offered by the National University of Singapore. The professional certificate in healthcare computational system will cover some of the topics I mentioned in the previous slide. Likewise, we have another professional certificate in healthcare analytics and data storytelling that will teach you about data analytics and how to present data analytics insights. We have another professional certificate in healthcare information management that talks about the various types of information system itself. And with all these certificates, you will be well tuned and proficient in carrying out health informatics. We'd like you to join us in this program, and that concludes my presentation. I hope that you have further understood what health informatics is, how important it is in today's context where we are surrounded by information technology. And with that, I would like to look at any questions you may have and would like to address them. I see that there are some questions being asked in the Q&A. Right, so we do have some comments perhaps. There is a danger of the system getting grounded by hackers. Absolutely, right? And that's where there's a need to understand information security, computer security, to ensure that the computers are not being hacked by hackers. Having said that, there are always hackers around that will try and probe into your system, and there's a need to be vigilant to ensure that your data are secure. The hospital auto measurement, some thermometer not working accurately. Okay, all right. So there's a device issue, all right? And certainly you will need to address that as well, right? Are there any devices to help stroke patients who have been discharged to help them do their activities of daily living at home? Stroke patients discharged to help them do their daily activity may not necessarily be automated devices. There are certainly devices that help them because a stroke patient possibly have lost their motor skill that is able to allow them to function normally. That has to be toughened up. They have to sort of nurse themselves for that itself. There are, of course, not just devices, but nursing care that put into it to help the patient to become more mobile in this case. In terms of devices, I think quite a lot of these devices are still very much in the research phase. We haven't really sort of come across devices for that, but certainly there are a lot of research being done to see how we can stimulate the brain to help them function better, right? All these are slowly being tested for that purpose itself. But in terms of commercial use, there are perhaps few of them, but still lacking in that way. Who is authorized to retrieve EMR system? Do GP or person can retrieve the health information? Is it classified? Right. Who is authorized? Obviously, not all doctors, as I mentioned just now, in hospitals where you have interaction with patients and you have to treat that patient. Most of these doctors in the hospitals are authorized to use the EMR system to capture their diagnosis and all those information into the EMR system. And do GP can retrieve the health information? Yes, GP through this software called GP Connect, they are also able to connect to the national EHR system to retrieve patient data in this case. This is something that slowly being opened up beyond hospital doctors towards the general practitioners in the clinic, right? as a healthcare administrator, such as human resource or finance, are there benefits to be trained in health informatics, and what would be these benefits itself? If you are a healthcare administrator, so you're not trained in a healthcare delivery, like a nurse, for example, so you wouldn't really be how should I put it? You may not, you will be trained in more of computer system, how computer system may be deployed in a healthcare environment itself. You may not be familiar with healthcare delivery, so there will be a lack of knowledge in the healthcare area itself. Unless you are familiar with it because you work in the environment, then that's fine. I mean, there will be benefit because people are looking for health informaticians that is able to connect IT with their deployment in hospital environment or healthcare institution itself. If you're not trained in healthcare, then basically you're an informatician for that matter, and you can work across any other sector for that, in that sense, right? Which software or language will be used for healthcare analytics course? Okay. Now, we have been training a number of healthcare professionals in healthcare analytics. We are mindful that most healthcare workers or professionals do not have a computing programming skill, and we certainly do not want to create difficulties or nightmare for them in trying to do programming. So generally what we will use is some software tools that enables analysis, data analysis. For example, Microsoft Excel is an example where you do not need to know any programming languages. So you simply do it graphically, right? To carry out healthcare analytics graphically. So that is usually the software that we'll use for healthcare analytics course in this case. Some of you may say, hey, why don't you train us in Python? Yes, we would like to, but I think most healthcare professionals might not be proficient enough to do a programming course in this case. And it does require some level of aptitude and understanding before you can even embark on sensible programming itself. All right. Can a person from non-IT degree and non-healthcare background attend this course? Yes, we do that. we do have a number of them. I wouldn't say a lot. Generally, those who attended our courses are already in the healthcare industry. For example, nurses or doctors, or people working in a pharmacy, or even allied health professionals who are doing therapy work, etc. So they are familiar with healthcare in that sense. That would be a better way by which we can deliver such courses to them. But if you are not in that, you may not want to. But if you are in a hospital environment, then you would like to go into such kind of courses. But if you're not in a healthcare environment, maybe in other industry, then you may not want to take this kind of program. You want to do other programs that we do have itself. All right, that might be able to help you better in that case. What are the 3 imminent priorities and/or factors that public healthcare should focus on for the next 5 years? All right. In the use of computer system, yes. What are the things that you asked me to name 3 priorities? One is to train people to learn to use data, and this is something that has become important. Organization, as I said before, that data are now being digitized. If you have digital data, you want to use the data for your decision making. And it's not just a selected group of people. People should have a mindset to say that, hey, how can I make use of the data that I have to do the work I'm doing to help me make better decisions? So I think that's something that people need to be trained in. Data analytics is something necessary to be trained in, all right? And then progressively, you can move on to learn a bit more about how you can interface with IT professionals. Leave the creation of software system to the IT professionals. As a health informatician itself, you should be able to relate how IT can be used effectively in your workplace itself. All right, so that is something that need to be brought forward to the healthcare professional, so that they be mindful that their work is not just the traditional work that they do in healthcare delivery. They must consider how they can use computer systems to hasten their work, to make their work more effective. I have a data science certificate from the NUS Business School. Can I use it and apply it to healthcare? I do not know what data science you've been trained in the NUS Business School, so I can't quite comment on that. Can it be applied? I hope. I'm not sure whether. Are you able to hear me? I'm not sure whether I'm losing battery on my earpiece here. I will need to switch.
Okay. Are you able to hear me? May or whoever? Can someone give me a
yes, I can
hear
you.
Okay, good. All right, good. Thank you. All right, so as I was saying, I do not know much about the data science certificate that you got from NUS Business School. But I trust that they really teach you data science from a business school perspective. Then well, in that case, any data science can be applied in any sector nevertheless, after all, you're talking about data, unless you're mindful of the kind of data that you use in healthcare. But otherwise, the skill that they teach you in that course itself should be applicable also in healthcare as well, all right? Where am I now? Which ministry or department helped to evolve the hospital from manual records to digital levels? Okay. Ministry of Health basically will be the one, because they take care of all the government hospitals. So Ministry of Health will have the prerogative to consider automation. But actually, the automation of the workflow itself very much the role of the task of the hospital itself, right? Each hospital has their own CEO, and they are the one probably consider how they should be the one giving the green light to automate the work that they do. But there is an IT department or IT unit that takes care of all the IT operations for all the government hospitals. That is known as IHIS, for Integrated Hospital Information System. If I get the acronyms correct, it's called IHIS. They are the one that basically take care of all the IT systems in government hospitals, and they will. The CEOs of the hospital will have in consultation with them to consider where they go for the digitalization effort itself. And in fact, all the hospitals have jointly come together and says, yeah, we need to have a next generation EMR system. And progressively over the last 3 years, over the last 5 years perhaps, they have been automating or changing into the next gen EMR system. All right. Will the courses help a person embark a career in this healthcare industry? Yes, it will help you to move in the health informatics area. All right. I wouldn't say that I'll train you to become a nurse in this case, because that is not the role of this program. But in terms of health informatics, recognition of your skill in health informatics, the hospital in Singapore certainly recognize that, because a number of nurses and as well as doctors have been trained through this health informatics program over here. Okay, right. I was told that time is up. Let me just try and finish up some of this. Is it easy to have a background in analytics and want to go into the health informatics field? If you have a background and then want to go, yeah, I think it should be all right. Not too difficult to do that. who and how much data governance before and after are being carried out in healthcare. Before, how much data governance are being carried out in healthcare? I suppose very much so. As I said, the IHIS itself are very much involved in the protection of the data as well. So they would have come out with the data governance with respect to data in healthcare. What would be the future healthcare industry like? Very much so. We're talking about digitalization. You can see how the finance industry have made use of data and they'll move similarly in that manner. Our medical data of Singapore transparent or viewable across all public healthcare institutions and cluster. Well, some data are available through the National Electronic Health Record Systems across the hospital in that sense. Are these courses only for people working in healthcare industry? Asking, since I'm the network engineer by profession, so trying to move across industry itself. Yeah, we will focus the topic from the healthcare industry itself. If you want to work in other industry, then you should take other courses that we have, not necessarily health informatics courses. Do we need to pay more fees for this course? All the courses are subsidized, all right? If you are Singaporean and more 40 and above, you just have to pay 10% of the course fee. Are there ongoing projects where candidate can sign up as unpaid intern, hence certified instead of coursework? I believe attained skill via project work will remain indefinitely. Okay, good. How can a trained standards informatician further progress his career? Need to practice. You need to practice. Then people will see the value in you. Okay. Is this course part-time or full-time? They're short courses, all right? 3 days course, most of them, right? And if you are 49 days and above, you just have to pay 10% of the course fee, provided in Singaporean or permanent resident. Any prerequisite? Most of the courses, there isn't any prerequisite. Okay.